Great. So I haven't introduced myself. So my name's Brio Lehman. My day job is that I'm a lecturer in statistics here at UCL. And my research is concerned with, I guess, developing statistical methods to better understand health inequalities with a particular focus on genomics and clinical trials. And then my other job is as the co-founder of Data Science for Health Equity, which is a community that we started with my colleague Maxine McIntosh almost 4 years ago now. So time has really flown. But over the last 4 years, we've built, I think, what is quite a vibrant and engaging community, and I'll talk a bit more about what the community does over the next few minutes. So our mission statement, if you will, is Data Science for Health Equity, which I'm going to shorten to DSxHE because it's just easier to say, is to build a world where data improves everyone's health. And I'll talk a bit how we're kind of trying to do that in a short moment. So there we go. So thanks, Jyoti. We're particularly proud to come up with that acronym because it just rolls off the tongue and it's quite kind of I think captures the essence of the community as well. So it's a really exciting time for, I think, the use of data science more broadly in healthcare and across the whole healthcare ecosystem. You see lots and lots of really great examples of how data science is being used to really positive effect. So here's just a few examples on this slide. I won't go into very much detail, but I think one of the most compelling examples of use of kind of data-driven tools is in medical imaging, where you see like really advanced and sophisticated machine learning techniques being used to analyze medical images and identify tumors and that kind of thing to really quite like amazing effect, to the extent that they're outperforming the gold standard of human radiologists. And you see like really great examples across the biomedical research and healthcare ecosystem. So including like in diagnosis, in the GP's office, to genomics, to population surveillance. We saw lots of use of data science during COVID for like modeling the spread of disease and trying to understand how infectious diseases spread throughout a country. So right at the beginning, where we're thinking about drug development and pharmaceuticals and how increasingly AI tools are being used to guide the development of drugs, and of course just more broadly in biomedical research, where we see data science and statistics has been used for many decades, but increasingly we're seeing the use of more sophisticated tools derived from machine learning or deep learning, and nowadays generative AI in how biomedical research is being undertaken. We also know that health inequity is a pervasive problem. So this is just a graph from the King's Fund from five years ago now. And it's kind of the headline figure in terms of life expectancy as a proxy for overall health against socioeconomic status or deprivation. So on the x-axis here you have socioeconomic status, and so each dot corresponds to a neighborhood in England. And the further left you are on this graph, the kind of more deprived this neighborhood is according to the index of multiple deprivation. And you see there's this really clear correlation in terms of life expectancy versus deprivation for these different neighborhoods, where the most deprived live on average 10 years less than the least deprived. So really stark differences in health outcomes along socioeconomic status. This is not just a national problem, it's also a global problem. And here, again, just a headline figure, but you have huge differences in life expectancy across different countries in the world, with in particular sub-Saharan Africa seeing much shorter life expectancies than wealthier countries in Western Europe and the US and Australia, for example. So it's both a national, within country issue, but also global, like international issue as well. It's also a very complex issue. So these are just graphs looking at life expectancy, which is one measure of health outcomes, but you can also think about many, many different types of health outcomes in terms of diagnosis, prognosis, and other measures of life expectancy, for example. Also, the factors leading or behind inequalities or inequity are very, very complex. And not going to go through all this graph. This is just a diagram from the World Health Organization, which is their kind of schematic for how they think about all the different factors which can contribute to health and health equity or health inequities. And so on the right is the overall impact on equity and health. And then you have the kind of intermediate determinants or social determinants, which are things to do with the material circumstances which are in, behavioral factors, but all these things are informed by the broader kind of socio-cultural environment in which we live. So, for example, your social class, gender, ethnicity, all either have a direct impact on health equity, but also on the material circumstances in which you live. And so these are very, very kind of complex interactions at play here. And it's not going to be kind of a one-size-fits-all silver bullet solution to solving health equity. So the question that we ask is, how can we ensure that the latest data-driven innovations that exist across the healthcare system benefit everyone's health? And that's really the kind of the purpose of data science for health equity as a community is to try and answer this question. So what is DSxHE? We're a community of practice for people working at the intersection of data science and health inequalities, or at least people who have like an interest in this space. We're a broad church. We have over 3,000 academics, healthcare workers, policymakers, folks working in the private sector, funders, and beyond who make up our community. We're striving to be an international community. Our kind of center of gravity is in the UK, but we do have members from across the world as well. What do we do? We have a bunch of different activities that we run as like a core community. So we have our download, which a couple of you may have attended, which is a virtual meetup where we have short talks and discussions around a particular topic. Our Slack workspace, which I know a few of you are on already, with I think approaching 1,000 members now, which is exciting for us, where people can ask questions, post funding and job opportunities that they've seen in their own work, and also just to connect with others in the space. We also have a library where all the kind of posts and articles that are shared within the DSxHE Slack, we kind of collect in our DSxHE library just as like an ongoing curated resource of things which might be relevant to people in the community. And lots and lots of events. So this is kind of our bread and butter. We love organizing events. We love organizing webinars, reading groups, workshops. We've done a couple of hackathons in the past, and we're kind of really enjoy this kind of community building aspect of our work. So the way that our community is structured is around particular themes. And themes are just focus areas led by members of the community who are typically doing this as part of their day job anyway, so with a particular focus, but who are kind of keen to connect their work to DSxHE to kind of augment the work that they're doing anyway. And so to tap into a wider pool of expertise and knowledge that they might not be able to connect with through their main work. So we have 5 themes at the moment that have been ongoing: mental health, participatory research, so patient and public involvement, statistical methods, a fairly new theme on children and families, and a theme on genomics. And of course, are very excited to announce our latest theme, which is on data diversity. So why do we want to start a new theme on data diversity? So the lack of representativeness or the lack of diversity in research studies is a challenge which faces so many biomedical applications. The kind of domain which I'm most familiar with is in genomics, where in genomics, the headline statistic is that 90% of participants in genome-wide association studies, so a particular type of genetic study, very common, 90% of participants in these types of studies are of European genetic ancestry. And so that's 90%, 9 out of 10 of all the participants. And that's despite the fact that folks of European ancestry only make up about 15% of the global population. So it's a huge skew towards people of European genetic ancestry. And you see similar patterns of the lack of representativeness in other domains. So historically, we know that clinical trials didn't tend to include women. Nowadays, for modern studies, this is better, but there are other examples of where we still see a clear lack of diversity in clinical trials. And you can find a kind of examples of the lack of representativeness across almost every domain. And so this lack of diversity can really impact whether research findings generalize to the wider population that you're interested in. If you run a clinical trial in a group of men and you find that the treatment effect is the treatment that you're interested in is effective, like can we guarantee that those results are going to transport to women, for example? And the answer is not. Sometimes the answer is yes, sometimes it's no, but you can't really conclude either way without having more diversity in your data. So it's really important to have diverse data to make sure that you can reliably assess whether research findings are valid and whether particular tools or interventions that you're developing based on this data are effective or not. And well, so data diversity is a challenge, and improving data diversity is also a complex and interdisciplinary challenge. There are lots of factors behind the fact that our data sets are not as diverse as they could be. I'm kind of keen to explore that a bit later in a discussion in a few minutes. Actually, we'll come to that discussion now. So I'm going to pause the recording, and I'm keen to let's see. Oh no, I clicked the wrong thing there. Right. So we have, this is just a slide on our new theme, data diversity. So this is a partnership with CR UK, and over the course of the next kind of 18 to 24 months, we're going to be running a bunch of activities on this theme of data diversity. So I've talked a bit about the reason that data diversity exists as a theme in terms of the need for the theme, but what is our kind of more specific goal? What we'd really like to do over the next 18 months or so is to create tools and solutions that make data diversity a standard part of the research ecosystem and not just an afterthought that's tacked on at the end of a research proposal, for example. So examples of things that we might do are to think about how can we write inclusive data collection protocols? How can we develop training resources to help people understand data diversity better as a problem and how to approach it in their own work, and also to potentially develop diversity frameworks for funders and regulators to understand how they to guide or influence how they should be thinking about diversity. These are just kind of illustrative examples, and a really important part of the theme will be to kind of gather what are the priorities for people working in this space for what they need most. So it could be case studies of like best practices, or like guidance on designing surveys, as Jyoti mentioned. So the rough plan over the next 18 months is as follows. So we're currently in our phase 0, where we're kind of introducing the theme to the wider community and building a theme team that's going to be leading on supporting these activities. The first phase, which I think will be really critical, is to do a bit of a landscape mapping exercise where we go out to the community and understand what work has already been in this space and gather examples of things that have gone well, or initiatives that have already looked at different aspects of this space, and to try and understand, what can we learn from initiatives that have already are already underway or have already finished. A really important part of this is also we're going to recruit a patient and public involvement panel, so patient advocates or members of the public who are going to guide the design of the whole theme. And so we really want to recruit participants from a diverse range of backgrounds to make sure that everything that we're doing is informed by the people who are ultimately going to be affected by these by the issue of diversity in data. So this landscape mapping will also identify the priorities of the community, also being informed by members of the PPIE panel to help us decide on which solutions are we going to try and focus on as a theme over the rest of the 18 months. So just quickly over the last 3 phases. So depending on what gets surfaced by that landscape mapping exercise, we'll co-design solutions and tools and frameworks that will hopefully make some headway into solving some of the issues that have arisen. And then we'll kind of validate and refine these solutions, and then run a bunch of activities to make sure that these solutions are reaching the people, the stakeholders who ultimately want to use them. So how can you get involved? We have a couple of theme roles. So we're actually recruiting a paid role of a theme lead, which is going to be between 0.1 and 0.2 full-time equivalent. So roughly half a day or a day a week, and the responsibility for they'll be responsible for kind of leading the activities of the theme and overseeing that we're kind of following everything and drawing from their own networks and expertise to ensure that we have like a diverse range of perspectives as well. So they'll be heavily involved, for example, with gathering the PPIE panel and making sure that we kind of recruit from a diverse range of backgrounds as well. We're also looking for theme volunteers to generally support the work of the theme, and this is kind of a commitment of roughly 2 hours a week, which is of course highly flexible. Other ways to get involved is you can subscribe to the theme mailing list, and if you go to this QR code, and I'll share the links in the chat very shortly, that'll take you to the newsletter, sorry, to our DSxHE homepage, where you can subscribe to our newsletter and then tick the data diversity mailing list. And if you're not on it already, you can join our Slack workspace, and then we have a specific channel on data diversity that you can join as well. And I see Nina's just asked, will we be sharing our journey for engaging these diverse voices? Yes, absolutely. That's, I think, something which is going to be absolutely key. We actually already have experience within DSxHE in recruiting a PPIE panel. So our mental health theme has been building a network of PPIE representatives to support some of the activities that they're running. And they'll be writing a blog over the course of the next month or so to document their experience in gathering this network. So that's something we're absolutely very happy to do. I'm going to stop recording.